Question 1. Which approach would be most appropriate for establishing a stable and functional occlusal scheme in a complex full-mouth rehabilitation case, considering the need for predictability and long-term success? Option A. Prioritizing rapid fabrication of final restorations based on impressions alone, with occlusal adjustments performed solely in the patient's mouth during delivery. Option B. Utilizing a diagnostic wax-up on articulated casts to establish centric relation and simulate excursive movements, followed by provisionalization and verification before final restoration. Option C. Relying on the patient's existing occlusal contacts as the primary guide for fabricating new restorations, making minimal adjustments to achieve perceived harmony. Option D. Implementing a predetermined occlusal scheme based on a generic ideal occlusion model, irrespective of the patient's current occlusal status or TMJ condition. Correct answer is B. Utilizing a diagnostic wax-up on articulated casts to establish centric relation and simulate excursive movements, followed by provisionalization and verification before final restoration. Explanation. This scenario is professionally challenging because achieving optimal occlusal harmony in a complex prosthodontic rehabilitation requires a nuanced understanding of both biomechanical principles and patient-specific factors. The dentist must balance the desire for ideal occlusal contacts with the reality of the patient's existing dentition, potential for wear, and the limitations of restorative materials. Careful judgment is required to select an approach that is both functionally sound and sustainable long-term, minimizing the risk of iatrogenic damage or patient dissatisfaction. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based methodology that accounts for the entire stomatognathix system. This involves thorough diagnostic assessment, including mounted casts and potentially diagnostic wax-ups to simulate proposed occlusal schemes. It emphasizes the establishment of stable centric relation and controlled excursive movements, aiming for bilateral balanced occlusion or mutually protected occlusion, depending on the clinical situation and restorative goals. This aligns with the professional duty of care to provide treatment that is predictable, functional, and preserves the health of the remaining oral structures. Adherence to established prosthodontic principles, as taught and assessed in regional board examinations, ensures that the chosen occlusal scheme is not only aesthetically pleasing, but also biomechanically sound and durable. An incorrect approach that relies solely on arbitrary occlusal schemes without comprehensive diagnostic records fails to meet the standard of care. This could lead to occlusal disharmony, premature wear of restorations, temporomandibular joint (TMJ) dysfunction, and damage to periodontal support. Ethically, this constitutes a failure to adequately diagnose and plan treatment, potentially exposing the patient to unnecessary risks and suboptimal outcomes. Another incorrect approach that neglects to consider the patient's existing occlusal pathways and instead imposes an entirely new, potentially incompatible scheme without adequate transition or verification, risks creating new occlusal interferences and patient discomfort. This demonstrates a lack of understanding of the dynamic nature of occlusion and the importance of gradual adaptation. A further incorrect approach that prioritizes speed over thoroughness, skipping critical diagnostic steps like mounting casts or evaluating excursive movements, directly violates the principles of sound prosthodontic practice and the expectation of meticulous care inherent in professional board examinations. Professionals should employ a decision-making framework that begins with a comprehensive patient history and clinical examination. This is followed by detailed diagnostic records, including radiographs, intraoral scans or impressions, and occlusal registrations. The analysis of these records, often in conjunction with mounted diagnostic casts, allows for the evaluation of various occlusal schemes. The chosen scheme should then be tested, ideally through a diagnostic wax-up or provisional restorations, before irreversible treatment is initiated. This iterative process ensures that the final treatment plan is tailored to the individual patient and offers the highest probability of long-term success, reflecting the rigorous standards expected in regional board examinations. Question 2. The review process indicates a patient presents with advanced periodontitis, characterized by significant bone loss, widened periodontal ligament spaces on radiographs, and areas of root surface demineralization. The patient expresses a desire to preserve their natural dentition and improve chewing function. Considering the developmental origins and regenerative potential of the periodontal ligament, cementum, and alveolar bone. Which of the following diagnostic and treatment planning approaches best addresses the patient's needs and aligns with best professional practice? Option A. Prioritize immediate surgical intervention to debride the affected areas without detailed assessment of regenerative potential, and then reassess the need for further treatment based on initial healing. Option B. Recommend extraction of all teeth with significant bone loss and replacement with a full mouth prosthesis, as regenerative therapies are considered too complex and unpredictable for this level of disease. Option C. Focus solely on aggressive scaling and root planing to remove irritants and instruct the patient on rigorous home care, assuming that improved hygiene will halt further bone loss without the need for regenerative interventions. Option D. Conduct a thorough periodontal probing and radiographic assessment to determine the extent of bone loss and periodontal ligament involvement. Develop a treatment plan that includes meticulous oral hygiene instruction, scaling and root planing, and consideration of regenerative periodontal surgical techniques where indicated to promote the regrowth of lost periodontal tissues. The correct answer is D. Conduct a thorough periodontal probing and radiographic assessment to determine the extent of bone loss and periodontal ligament involvement. Develop a treatment plan that includes meticulous oral hygiene instruction, scaling and root planing, and consideration of regenerative periodontal surgical techniques where indicated to promote the regrowth of lost periodontal tissues. Explanation. This scenario presents a common challenge in clinical dentistry where a patient's periodontal health is compromised, impacting the supporting alveolar bone and the integrity of the periodontal ligament. The professional challenge lies in accurately diagnosing the extent of damage and formulating a treatment plan that not only addresses the immediate disease, but also considers the long-term regenerative potential of these crucial tissues. Understanding the embryological development and cellular processes involved in the formation and maintenance of the periodontal ligament, cementum, and alveolar bone is paramount for making informed decisions. The correct approach emphasizes a comprehensive assessment and a treatment strategy that aims for regeneration where possible, aligning with the principles of evidence-based dentistry and patient-centered care. This involves utilizing diagnostic tools to evaluate the existing bone levels, the health of the periodontal ligament fibers, and the quality of cementum, and then selecting interventions that can stimulate or support the natural regenerative processes of these tissues. This approach is ethically sound, as it prioritizes the patient's well-being and aims for the best possible functional and structural outcome, respecting the biological capacity of the oral tissues. Incorrect approaches fail to adequately consider the biological underpinnings of periodontal regeneration or the patient's specific condition. One incorrect approach might involve solely focusing on plaque control without addressing the underlying structural damage or exploring regenerative options, thereby neglecting the potential for tissue repair and regeneration. This could be considered a failure in providing comprehensive care and potentially violating ethical obligations to offer the most beneficial treatment. Another incorrect approach might involve aggressive surgical interventions without a clear regenerative goal or without considering the patient's systemic health, which could lead to iatrogenic damage and compromise healing. This would represent a failure in adhering to principles of minimally invasive dentistry and patient safety, potentially contravening regulatory guidelines that mandate appropriate risk-benefit assessments. A third incorrect approach might involve overlooking the importance of the periodontal ligament's role in proprioception and tooth support, leading to a treatment plan that does not adequately restore function or stability. This demonstrates a lack of understanding of the interconnectedness of periodontal structures and a failure to provide holistic care. The professional decision-making process for similar situations should involve a systematic evaluation. First, a thorough clinical and radiographic examination to assess the current state of the periodontal tissues. Second, consideration of the patient's medical history and risk factors. Third, identification of treatment goals, including disease control and potential for regeneration. Fourth, exploration of evidence-based treatment options, weighing their risks and benefits. And finally, clear communication with the patient about the diagnosis, treatment plan, prognosis, and alternatives, ensuring informed consent. Question 3. The analysis reveals that a dentist is planning a complex full-mouth rehabilitation case requiring precise occlusal reconstruction. The patient presents with a history of bruxism and has undergone previous restorative work that has shown signs of wear. The dentist has access to a dental laboratory with varying levels of technical capability. Considering the need for accurate simulation of mandibular movements and the potential for occlusal disharmony, which type of articulator would best facilitate a predictable and functional outcome for this challenging case? Option A. A simple hinge articulator, as it allows for basic opening and closing movements. Option B. A semi-adjustable articulator programmed with patient-specific condylar guidance and incisal table settings derived from accurate interclusal records. Option C. A fully adjustable articulator, without specific consideration for the accuracy of the interocclusal records or the laboratory's programming expertise. Option D. An articulator chosen primarily based on its lower cost and immediate availability. The correct answer is B. A semi-adjustable articulator programmed with patient-specific condylar guidance and incisal table settings derived from accurate interocclusal records. Explanation. This scenario presents a professional challenge due to the need to select an appropriate articulator for a complex restorative case, balancing patient needs, laboratory capabilities, and the inherent limitations of different articulator types. Careful judgment is required to ensure the chosen articulator accurately reflects the patient's mandibular movements, thereby facilitating predictable and functional prosthetic outcomes. The correct approach represents best professional practice because it prioritizes the use of an advanced semi-adjustable articulator. This choice is justified by its ability to be programmed with patient-specific condylar guidance and incisal table settings, derived from accurate interocclusal records. This level of customization is crucial for replicating the patient's unique jaw movements, minimizing occlusal adjustments in the mouth, and ensuring long-term stability and patient comfort. Adherence to regional board examination guidelines emphasizes the importance of selecting diagnostic and treatment aids that offer the highest degree of accuracy and predictability in restorative dentistry. An incorrect approach would be to select a simple hinge articulator for this case. This fails to meet professional standards because hinge articulators only allow for simple opening and closing movements and cannot replicate lateral or protrusive excursions. This lack of kinematic accuracy can lead to significant occlusal discrepancies in the final restoration, requiring extensive chairside adjustments, potentially compromising the longevity of the restoration and causing patient dissatisfaction. Ethically, it represents a failure to provide the standard of care expected in complex restorative cases. Another incorrect approach would be to select a fully adjustable articulator without the necessary diagnostic records or laboratory expertise to program it accurately. While offering the highest potential for accuracy, an improperly programmed fully adjustable articulator can be as detrimental as a simple hinge. This approach is professionally unacceptable as it demonstrates a misunderstanding of the practical application of advanced technology and a potential waste of resources, failing to deliver the promised benefits of precision. It also risks creating an occlusion that is not representative of the patient's actual jaw function. Finally, choosing an articulator based solely on cost or availability without considering its suitability for the specific clinical demands of the case is professionally unsound. This approach neglects the primary objective of restorative dentistry: to create functional, durable, and aesthetically pleasing restorations that restore or improve oral health, prioritizes convenience over patient well-being and the integrity of the treatment outcome, which is a direct contravention of ethical practice and the implicit requirements of regional board examinations to demonstrate competence in patient-centered care. The professional decision-making process for similar situations should involve a thorough assessment of the clinical case complexity, the patient's specific occlusal needs, the available diagnostic information, e.g., mounted study models, interocclusal records, the capabilities of the dental laboratory, and the practitioner's own expertise. The selection of diagnostic and treatment aids, including articulators, should be a deliberate choice driven by the goal of achieving the most accurate and predictable outcome for the patient, aligning with established professional standards and ethical obligations. Question 4. The assessment process reveals a 7-year-old patient presenting with delayed eruption of permanent incisors and a noticeable absence of primary incisor shedding. The parent expresses concern, stating that other children of similar age have already lost their primary incisors. The examining professional must determine the most appropriate next step in managing this situation, considering typical developmental timelines and potential underlying factors. Option A. Immediately refer the patient to an orthodontist for a comprehensive orthodontic evaluation and potential early intervention. Option B. Focus solely on the absence of primary incisor shedding, assuming it is the primary cause of the permanent incisor delay, and recommend extraction of the primary teeth. Option C. Reassure the parent that variations in shedding and eruption are common and advise them to wait another year before any further evaluation. Option D. Conduct a thorough clinical examination, including palpation for unerupted teeth and a panoramic radiograph, to assess the presence, position, and development of permanent teeth, and to identify any potential obstructions or anomalies. The correct answer is D. Conduct a thorough clinical examination, including palpation for unerupted teeth and a panoramic radiograph, to assess the presence, position, and development of permanent teeth, and to identify any potential obstructions or anomalies. Explanation: this scenario presents a professional challenge due to the inherent variability in tooth eruption and shedding timelines, compounded by the need to adhere to established regional dental board guidelines for assessment. Professionals must exercise careful judgment to differentiate between normal developmental variations and potential underlying pathologies that might require intervention or further investigation. The challenge lies in balancing expectant management with timely diagnosis and treatment, all within the scope of regulatory expectations for patient care. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that aligns with regional dental board examination standards. This involves a thorough clinical examination, consideration of the patient's overall developmental stage, and appropriate radiographic evaluation when indicated. Such an approach ensures that any deviations from the norm are identified and addressed promptly, fulfilling the professional duty of care and adhering to the implicit requirement of maintaining up-to-date knowledge of developmental norms as expected by examining bodies. This method is ethically sound, prioritizing patient well-being and informed decision-making. An incorrect approach that relies solely on parental anecdotal evidence without objective clinical or radiographic correlation would be professionally unacceptable. This fails to meet the standard of care expected by regional boards, which emphasize objective assessment. Ethically, it risks misdiagnosis or delayed diagnosis, potentially harming the patient. Another incorrect approach, such as immediately recommending invasive interventions without a thorough differential diagnosis, disregards the principle of first, do no harm, and may lead to unnecessary procedures, violating professional conduct guidelines and potentially exposing the patient to iatrogenic complications. Furthermore, an approach that dismisses parental concerns entirely without proper evaluation also represents a failure in communication and patient-centered care, which are often implicitly or explicitly covered in professional conduct regulations. Professionals should employ a systematic decision-making process that begins with gathering a detailed history, followed by a comprehensive clinical examination. This should then be integrated with radiographic findings and an understanding of normal developmental sequences. When faced with deviations, a differential diagnosis should be formulated, and further investigations or consultations pursued as necessary, always referencing current regional guidelines and best practices for assessment and management. Question 5. The evaluation methodology shows that a radiologist is reviewing a CT scan of the facial bones. To accurately report findings related to potential trauma or pathology, the radiologist must possess a comprehensive understanding of the intricate details of each facial bone. Considering the maxilla, mandible, zygomatic, nasal, lacrimal, palatine, vomer, and inferior nasal conchae, which of the following best demonstrates the required depth of anatomical knowledge concerning their detailed features, articulations, and landmarks? Option A. Differentiating between the superior and inferior orbital fissures based on their relative positions within the orbit, without specific reference to the bones forming these structures. Option B. Describing the precise articulation of the maxilla with the ethmoid, nasal, lacrimal, palatine, vomer, and inferior nasal conchae, and detailing the infraorbital foramen as a key landmark on the maxilla. Option C. Identifying the overall shape of the mandible and its articulation with the temporal bone, while also recognizing the general location of the zygomatic arch. Option D. Recognizing the presence of the nasal septum and its general composition, without specifying the contribution of the vomer and perpendicular plate of the ethmoid. Correct answer is C. identifying the overall shape of the mandible and its articulation with the temporal bone, while also recognizing the general location of the zygomatic arch. Explanation. This scenario presents a professional challenge due to the critical nature of accurately identifying and documenting facial bone structures in a medical imaging context, which directly impacts diagnosis and treatment planning. The need for precise anatomical knowledge of the maxilla, mandible, zygomatic, nasal, lacrimal, palatine, vomer, and inferior nasal conchae, including their detailed features, articulations, and landmarks, is paramount. Misidentification can lead to significant diagnostic errors, potentially causing patient harm and leading to medico-legal consequences. The correct approach represents best professional practice because it demonstrates a thorough understanding of the anatomical basis required for interpreting diagnostic imaging of the facial skeleton. Adherence to established anatomical terminology and recognition of key features and articulations are fundamental to accurate reporting. This aligns with the implicit regulatory expectation within medical board examinations to assess a candidate's foundational knowledge necessary for safe and effective practice. Ethical practice demands that professionals possess and apply accurate anatomical knowledge to avoid misdiagnosis and ensure patient well-being. An incorrect approach that focuses solely on superficial visual characteristics without understanding the underlying bony articulations and specific landmarks would be professionally unacceptable. This failure represents a lack of depth in anatomical comprehension, which is a direct contravention of the expected standard of care. Such an approach could lead to misinterpreting fractures, identifying developmental anomalies incorrectly, or failing to recognize the extent of pathology, thereby compromising patient care and potentially violating professional conduct standards. Another incorrect approach that prioritizes a general overview of the facial skeleton over the detailed features of individual bones would also be professionally deficient. While a broad understanding is necessary, the examination specifically targets detailed knowledge. This approach would fail to meet the specific assessment objectives of the examination, which are designed to test granular anatomical expertise. Ethically, this demonstrates a superficial engagement with the subject matter, which is insufficient for the responsibilities of a medical professional dealing with complex anatomical structures. A further incorrect approach that conflates the functions of different facial bones without accurately describing their morphological features and articulations would be equally problematic. Function is often inferred from structure, and a failure to accurately describe the structure, including the precise articulations, e.g., the maxilla with the ethmoid, nasal, lacrimal, palatine, vomer, inferior nasal conchae, and zygomatic bones, would undermine the diagnostic process. This represents a fundamental misunderstanding of anatomical relationships, which is a significant ethical and professional failing. The professional decision-making process for similar situations should involve a systematic review of anatomical knowledge, focusing on the specific requirements of the task or examination. This includes recalling and applying detailed information about bone morphology, articulations, and clinically relevant landmarks. When faced with diagnostic imaging, the professional should cross-reference findings with established anatomical atlases and diagnostic criteria, ensuring that their interpretation is grounded in accurate anatomical understanding. In an examination context, this translates to carefully analyzing the question's focus and selecting the option that most accurately reflects the detailed anatomical knowledge being tested. Question 6. During the evaluation of a patient scheduled for a thyroidectomy, what is the most critical consideration regarding the hypoglossal nerve, CN Roman 12, and its potential impact on postoperative function? Option A. Assessing the patient's gag reflex, as the hypoglossal nerve is a primary afferent component of this reflex. Option B. Confirming the patient's ability to taste on the anterior two-thirds of the tongue, as this nerve also carries taste fibers. Option C. Ensuring the patient can adequately protrude their tongue without deviation, which is indicative of intact hypoglossal nerve function. Option D. Evaluating the patient's ability to elevate their soft palate, which is primarily controlled by the vagus nerve. The correct answer is C. Ensuring the patient can adequately protrude their tongue without deviation, which is indicative of intact hypoglossal nerve function. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to integrate knowledge of cranial nerve function with the potential for iatrogenic injury during a common surgical procedure. The hypoglossal nerve, CN Roman 12, controls tongue movement, crucial for speech, swallowing, and airway patency. Damage, even subtle, can have significant functional consequences for the patient. The challenge lies in anticipating and mitigating this risk within the constraints of a surgical field where anatomical landmarks can be distorted. Correct approach analysis. The correct approach represents best professional practice by prioritizing patient safety through meticulous surgical technique and informed consent. This involves a thorough understanding of the hypoglossal nerve's anatomical course relative to the surgical site, employing techniques to visualize and protect it, and ensuring the patient is fully aware of the potential risks, including nerve injury, prior to the procedure. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as regulatory requirements for informed consent and adherence to established surgical standards of care. Incorrect approaches analysis. One incorrect approach involves proceeding with the surgery without specific consideration for the hypoglossal nerve's proximity, assuming it will not be affected. This demonstrates a failure to adhere to the principle of non-maleficence and a disregard for established surgical best practices that mandate awareness of critical anatomical structures. It also potentially violates regulatory requirements for due diligence in surgical planning and execution. Another incorrect approach is to perform the surgery with a cursory awareness of the nerve, but without employing specific protective measures or intraoperative monitoring. This falls short of the standard of care, as it fails to actively mitigate a known risk. Ethically, it prioritizes surgical expediency over optimal patient safety. A third incorrect approach is to obtain consent, but then disregard the potential for nerve injury during the procedure, perhaps due to overconfidence or a lack of vigilance. This represents a failure in the ongoing duty of care to the patient and a potential breach of informed consent, as the patient was not adequately protected from the discussed risk. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive preoperative assessment, including a review of relevant anatomy and potential surgical complications. This should be followed by a detailed discussion with the patient to obtain informed consent, clearly outlining all potential risks, including specific nerve injuries and their functional implications. During the procedure, meticulous surgical technique, visualization of critical structures, and the use of appropriate protective measures are paramount. Post-operatively, vigilant monitoring for signs of nerve dysfunction and prompt management of any complications are essential components of ongoing patient care. Question 7. Quality control measures reveal that a candidate for the regional board examinations has provided a detailed description of the arterial supply to the head and neck, specifically outlining the common carotid artery, its bifurcation into the external and internal carotid arteries, and the key branches arising from each. However, the candidate's explanation of the internal carotid artery's contribution to the cerebral circulation and the external carotid arteries supply to superficial and deep structures of the face and scalp appears to be based on a general anatomical understanding, rather than the specific emphasis and terminology required by the examination's regulatory framework. Which of the following approaches best demonstrates adherence to the jurisdictional requirements of the regional board examinations in this context? Option A. Focusing on memorizing the names of all possible branches of the external and internal carotid arteries without understanding their specific roles or the regional emphasis of the examination. Option B. Relying on a widely recognized international anatomy textbook that provides extensive detail on the cerebral and facial arterial supply, assuming this general knowledge will be sufficient for the examination. Option C. Prioritizing a comprehensive review of the official syllabus and past examination papers to identify the specific level of detail, terminology, and clinical relevance expected for the common carotid, external carotid, and internal carotid arteries, and their branches within the context of the examination's jurisdiction. Option D. Consulting general medical websites and forums to gather additional information on carotid artery anatomy, assuming diverse sources will provide a more complete picture. The correct answer is C. Prioritizing a comprehensive review of the official syllabus and past examination papers to identify the specific level of detail, terminology, and clinical relevance expected for the common carotid, external carotid, and internal carotid arteries, and their branches within the context of the examination's jurisdiction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the professional to interpret a complex anatomical description within the context of a specific regulatory framework, likely related to medical device approval or clinical trial documentation. The challenge lies in accurately mapping the described anatomical structures and their relationships to the precise language and requirements of the relevant regional board examination's regulatory guidelines. Misinterpretation could lead to incorrect assessments, potentially impacting patient safety or regulatory compliance. Correct approach analysis. The correct approach represents best professional practice because it demonstrates a thorough understanding of both the anatomical subject matter and the specific regulatory requirements of the regional board examinations. It involves meticulously cross-referencing the detailed description of the common carotid, external carotid, and internal carotid arteries, and their branches against the established terminology, classification system, and documentation standards mandated by the exam's jurisdiction. This ensures that the professional's understanding aligns with the expected level of detail and accuracy required for regulatory purposes, thereby upholding the integrity of the examination process and its intended outcomes, which are designed to ensure competent practice within that jurisdiction. Incorrect approach is analysis. An approach that focuses solely on a general anatomical understanding without considering the specific regulatory context of the regional board examinations is professionally unacceptable. This fails to meet the core requirement of the exam, which is to assess knowledge as it applies within a defined regulatory framework. Such an approach would likely lead to answers that are factually correct in a general medical sense, but do not adhere to the specific nomenclature, classification, or emphasis dictated by the exam's jurisdiction, thus failing the regulatory compliance aspect. An approach that prioritizes memorization of isolated facts about the arteries without understanding their interrelationships and clinical significance, as defined by the exam's scope, is also professionally flawed. Regional board examinations typically assess applied knowledge. If the exam requires understanding how these arteries supply specific regions or their relevance in certain pathologies, a purely isolated factual recall will be insufficient and will not demonstrate the required depth of understanding for regulatory approval or clinical application within that jurisdiction. An approach that relies on information from external, non-jurisdictional sources, e.g., textbooks from other countries or general medical websites not aligned with the exam-specific curriculum, is a significant regulatory and ethical failure. This introduces the risk of using outdated, inaccurate, or jurisdictionally inappropriate information. The exam's purpose is to validate knowledge against its own defined standards, and deviating from these standards undermines the entire assessment process and could lead to the certification of individuals who do not meet the local regulatory requirements for practice. Professional reasoning. Professionals facing such a scenario should first identify the specific regulatory framework governing the regional board examinations. They must then engage in a detailed study of the arterial system, specifically focusing on the common carotid, external carotid, and internal carotid arteries and their branches, as presented within the official study materials or syllabus for that examination. This involves not just memorizing anatomical facts, but understanding their functional anatomy, clinical relevance, and any specific classifications or terminology emphasized by the regulatory body. The professional should then practice applying this knowledge to questions that mimic the style and rigor of the examination, constantly cross-referencing their understanding with the official guidelines. If ambiguity arises, seeking clarification from official exam resources or instructors is paramount. The decision-making process should prioritize adherence to the defined regulatory scope and standards above all else. Question 8. The assessment process reveals a candidate's response regarding the oral mucosa's epithelial structure, which mentions the presence of keratin, but fails to elaborate on the distinct types of stratified squamous epithelium and their specific locations and functional implications within the oral cavity. Considering the detailed anatomical requirements for regional board examinations, which of the following best reflects the expected level of understanding and the potential implications of this knowledge gap? Option A. The candidate's response is insufficient as it lacks the detailed differentiation between keratinized stratified squamous epithelium, non-keratinized stratified squamous epithelium, and specialized epithelia, which is crucial for understanding variations in oral tissue function and pathology. Option B. The candidate's mention of keratin is adequate, as it is the most significant feature of oral epithelium for diagnostic purposes. Option C. The candidate demonstrates a fundamental understanding of oral epithelium by identifying keratin, which is a key component of protective tissues. Option D. The candidate's response is acceptable because the primary focus of oral mucosa assessment is on clinical presentation rather than microscopic anatomical detail. The correct answer is C. The candidate demonstrates a fundamental understanding of oral epithelium by identifying keratin, which is a key component of protective tissues. Explanation. The assessment process reveals a candidate demonstrating a superficial understanding of the oral mucosa's detailed anatomy, specifically the nuances of its epithelial types. This scenario is professionally challenging because it requires the assessor to evaluate not just factual recall, but also the candidate's judgment in applying this knowledge ethically and professionally within the context of regional board examinations. The core of the challenge lies in distinguishing between a minor knowledge gap and a potential risk to future patient care, necessitating a careful and principled approach to assessment. The correct approach represents best professional practice because it prioritizes patient safety and the integrity of the profession. By requiring a thorough and accurate understanding of anatomical structures, including the different types of oral epithelium, e.g., stratified squamous keratinized, stratified squamous non-keratinized, and specialized epithelia like those found on the tongue, the examination ensures that candidates possess the foundational knowledge necessary for accurate diagnosis and treatment planning. This aligns with the overarching regulatory and ethical duty of care inherent in healthcare professions, as mandated by the principles of competence and professional responsibility that underpin all regional board examinations. An incorrect approach that focuses solely on identifying the presence of keratin without differentiating its extent or the underlying epithelial stratification would be professionally unacceptable. This failure would represent a significant regulatory and ethical lapse, as it overlooks critical anatomical distinctions that are vital for understanding tissue resilience, susceptibility to injury, and the potential for pathological changes. Such an approach would demonstrate a lack of depth in anatomical knowledge, potentially leading to misinterpretations of clinical findings and compromising patient care. Another incorrect approach might involve conflating the functions of different epithelial types, such as attributing the protective role of keratinized epithelium to non-keratinized areas without qualification. This would be an ethical failure due to the potential for diagnostic error and a regulatory failure in demonstrating the required level of competence. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the learning objectives and the depth of knowledge expected for the specific examination. Second, assess the candidate's response against these defined standards, looking for accuracy, completeness, and the ability to apply knowledge. Third, if a deficiency is identified, consider its potential impact on safe practice. Finally, ensure the assessment is conducted fairly, consistently, and in accordance with the established examination protocols and ethical guidelines of the relevant regulatory body. This systematic process helps to uphold the standards of the profession and protect the public. Question 9. Regulatory review indicates that a new patient presents with a noticeable protrusion of the upper incisors and a retruded mandible. During the clinical examination, the practitioner observes that the mesiobuccal cusp of the maxillary first molar occludes anterior to the buccal groove of the mandibular first molar. The patient also exhibits a significant overjet. Based on Engel's classification system, how should this malocclusion be categorized, and what are its primary characteristics? Option A. Class Roman II malocclusion, characterized by the maxillary first molar occluding anterior to its normal position relative to the mandibular first molar, and often associated with increased overjet and a retruded mandible. Option B. Class Roman II malocclusion, characterized by the maxillary first molar occluding posterior to its normal position relative to the mandibular first molar, and often associated with increased overjet and a prognathic mandible. Option C. Class Roman III malocclusion, characterized by the maxillary first molar occluding posterior to its normal position relative to the mandibular first molar, and often associated with prognathism of the mandible and underjet. Option D. Class I malocclusion, characterized by the normal anterior-posterior relationship of the molars, with the mesiobuccal cusp of the maxillary first molar occluding with the buccal groove of the mandibular first molar, and typically presenting with balanced facial profiles. Correct answer is A. Class Roman II malocclusion, characterized by the maxillary first molar occluding anterior to its normal position relative to the mandibular first molar, and often associated with increased overjet and a retruded mandible. Explanation: scenario analysis. This scenario presents a common diagnostic challenge in orthodontics, requiring the practitioner to accurately classify a patient's malocclusion based on specific anatomical landmarks and their relationships. Misclassification can lead to inappropriate treatment planning, potentially resulting in suboptimal outcomes, patient dissatisfaction, and even professional repercussions. The challenge lies in applying the theoretical framework of Engel's classification to a real-world clinical presentation, considering the nuances and variation that often exist. Correct approach analysis. The correct approach involves a systematic assessment of the patient's occlusal relationships, specifically focusing on the anterior-posterior relationship of the first permanent molars and the canine guidance. This aligns with the foundational principles of Engel's classification, which categorizes malocclusions into Class I, Class Roman II, and Class Roman III based on these key indicators. A thorough examination, including assessment of the midline, overjet, overbite, and any signs of crowding or spacing, further refines the diagnosis within the chosen classification. This methodical approach ensures that the diagnosis is evidence-based and directly reflects the established criteria for Engel's classification, leading to appropriate treatment planning and adherence to professional standards of care. Incorrect approaches analysis. One incorrect approach would be to base the classification solely on the perceived aesthetic appearance of the patient's profile without a detailed occlusal analysis. This fails to adhere to the objective criteria of Engel's classification and can lead to misdiagnosis. Ethically, it represents a departure from evidence-based practice and could result in ineffective or even harmful treatment. Another incorrect approach would be to focus exclusively on the anterior teeth relationship, e.g., incisor overjet, while neglecting the crucial posterior occlusal relationships, particularly the molar relationship. Engel's classification is fundamentally rooted in the molar relationship as the primary determinant of the anterior-posterior classification. Ignoring this key component renders the classification incomplete and inaccurate, violating the established diagnostic framework. A third incorrect approach would be to prematurely decide on a treatment modality before a definitive classification is established. This reverses the logical diagnostic process. Treatment planning must be informed by a precise diagnosis. Making treatment decisions based on assumptions or preliminary observations, rather than a confirmed malocclusion classification, is a significant professional and ethical lapse, potentially leading to inappropriate interventions. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive clinical examination. This includes visual inspection, palpation, and assessment of occlusal relationships using diagnostic aids such as study models or intraoral scans. The practitioner must then systematically apply the established diagnostic criteria, in this case, Engel's classification, by evaluating the molar and canine relationships. Any discrepancies or complexities should be noted and considered. Only after a definitive diagnosis is reached should treatment options be explored, ensuring that the chosen interventions are directly aligned with the identified malocclusion and the patient's specific needs and goals, in accordance with regulatory guidelines for patient care. Question 10. Market research demonstrates that candidates often struggle with the precise scope of examination for the muscles of mastication as defined by the regional board examinations. Considering the regulatory framework, which of the following approaches best aligns with the mandated assessment of these muscles? Option A. Palpating only the masseter and temporalis muscles for tenderness and assessing their functional contraction. Option B. Palpating the masseter and temporalis muscles for tenderness and assessing their functional contraction, and performing a detailed acoustic analysis of the temporomandibular joint. Option C. Palpating the masseter and temporalis muscles for tenderness and assessing their functional contraction, while also palpating the medial and lateral pterygoid muscles for tenderness and assessing their functional contraction. Option D. Palpating the masseter and temporalis muscles for tenderness and assessing their functional contraction, and assessing the range of motion of the temporomandibular joint through passive manipulation. The correct answer is C. Palpating the masseter and temporalis muscles for tenderness and assessing their functional contraction, while also palpating the medial and lateral pterygoid muscles for tenderness and assessing their functional contraction. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an individual to interpret and apply specific regulatory requirements related to the examination of the muscles of mastication. The challenge lies in understanding the nuances of what constitutes a complete and compliant examination within the defined regulatory framework, ensuring that all mandated components are addressed without overstepping the scope of practice or failing to meet the minimum standards. Accurate judgment is required to differentiate between a thorough, compliant examination and one that is either insufficient or deviates from established protocols. Correct approach analysis. The correct approach represents best professional practice because it directly adheres to the explicit requirements outlined by the regional board examination's regulatory framework for assessing the muscles of mastication. This approach ensures that the examination covers all mandated anatomical structures and functional assessments as stipulated by the governing body. By focusing solely on the prescribed elements, it demonstrates regulatory compliance, ethical practice by staying within the defined scope, and professional competence by executing the examination according to established standards. This meticulous adherence prevents potential disciplinary actions and upholds the integrity of the examination process. Incorrect approaches analysis. An approach that omits assessment of the pterygoid muscles fails to meet the regulatory requirement for a comprehensive examination of masticatory muscles. This omission constitutes a direct regulatory failure, as it neglects a key component mandated by the examination guidelines. Ethically, it represents a failure to provide a complete and accurate assessment, potentially misleading the examining body about the candidate's full competency. An approach that includes assessment of the temporomandibular joint's range of motion beyond palpation of muscle activity, such as detailed acoustic analysis or advanced imaging, exceeds the defined scope of examination for the muscles of mastication, as per the regional board examinations framework. This constitutes a regulatory overreach, as it introduces elements not specified or authorized for this particular assessment. Ethically, it could be seen as an attempt to impress beyond the required standard, potentially misrepresenting the focus of the examination and consuming unnecessary time or resources. An approach that only palpates the masseter and temporalis muscles without assessing their function or considering the contribution of other masticatory muscles is insufficient. This represents a regulatory failure due to incomplete assessment, violating the requirement for a thorough evaluation. Ethically, it demonstrates a lack of diligence and a failure to provide a comprehensive picture of the candidate's understanding and ability to examine all relevant muscles. Professional reasoning. Professionals facing such scenarios should first meticulously review the specific regulatory framework and guidelines provided for the regional board examinations. They must identify all mandated components of the examination for the muscles of mastication. The decision-making process should prioritize adherence to these explicit requirements, ensuring that the examination is both complete and within the defined scope. When in doubt about the interpretation of a guideline, seeking clarification from the examination board or a senior professional is a crucial step. The professional's judgment should be guided by the principle of fulfilling all regulatory obligations accurately and ethically, avoiding both omissions and unnecessary additions. Question 11. Process analysis reveals that a stakeholder is seeking to understand the fundamental embryological origins of facial clefts and malocclusions. Which approach best facilitates their comprehension of these complex developmental processes? Option A. Describing the clinical presentation and surgical management of common facial clefts and malocclusions, and then briefly mentioning that these conditions arise from developmental errors during embryogenesis, without delving into the specific embryological mechanisms. Option B. Presenting a chronological list of key embryological events from week 3 to week 12 of gestation, focusing on the formation of individual facial bones and tooth buds, without explicitly linking these events to the etiology of specific congenital anomalies or dental irregularities. Option C. Detailing the specific gene regulatory networks and signaling pathways involved in the fusion of the frontonasal and maxillary processes, and then explaining how disruptions in these pathways can lead to various types of facial clefts, followed by a discussion of the embryonic origins of the mandibular and maxillary bones, and the factors influencing their growth and alignment to address malocclusions. Option D, providing a simplified overview of the major embryonic structures that form the face and jaws, such as the pharyngeal arches and neural crest cells, and explaining how their coordinated development and fusion are essential for normal facial and dental formation, highlighting common points of developmental disruption that can result in clefts and malocclusions. The correct answer is C, detailing the specific gene regulatory networks and signaling pathways involved in the fusion of the frontonasal and maxillary processes, and then explaining how disruptions in these pathways can lead to various types of facial clefts, followed by a discussion of the embryonic origins of the mandibular and maxillary bones, and the factors influencing their growth and alignment to address malocclusions. Explanation. This scenario presents a professional challenge due to the inherent complexity of embryological development and the potential for misinterpretation or oversimplification when communicating this information to stakeholders with varying levels of scientific understanding. The core difficulty lies in accurately conveying the intricate processes of facial, jaw, and tooth formation, including the critical timing of developmental events and the origins of potential anomalies, without resorting to overly technical jargon or misleading analogies. The correct approach represents best professional practice because it prioritizes clear, accurate, and contextually appropriate communication. It acknowledges the stakeholders' perspective and tailors the explanation to their needs, ensuring they grasp the fundamental embryological principles relevant to their inquiry. This aligns with ethical obligations to provide truthful and understandable information, fostering informed decision-making and trust. Specifically, it demonstrates an understanding of the developmental origins of structures and potential deviations, which is crucial for any professional involved in fields where this knowledge is applied, such as dentistry, medicine, or genetic counseling. An incorrect approach that focuses solely on listing developmental stages without explaining their significance or interrelationships fails to provide meaningful insight. This is ethically problematic, as it can lead to a superficial understanding and potentially incorrect conclusions by the stakeholder. Another incorrect approach that emphasizes rare or complex syndromes without first establishing a foundational understanding of normal development is also flawed. This can cause undue alarm or confusion, violating the principle of providing information that is both accurate and helpful. A third incorrect approach that uses overly simplistic or anthropomorphic language to describe developmental processes risks misrepresenting the biological reality and can undermine the credibility of the professional. This is an ethical failure as it prioritizes ease of communication over scientific accuracy. Professionals should employ a decision-making framework that begins with understanding the stakeholder's specific question and their existing knowledge base. This involves active listening and asking clarifying questions. Next, the professional should identify the core embryological concepts relevant to the inquiry. The explanation should then be constructed, starting with fundamental principles and progressively introducing complexity as needed, always using precise terminology where appropriate and clarifying any potentially ambiguous terms. Finally, the professional should solicit feedback to ensure comprehension and address any remaining questions, reinforcing the commitment to clear and ethical communication. Question 12. Implementation of a comprehensive occlusal rehabilitation plan requires careful consideration of multiple factors. Which of the following approaches best reflects a thorough understanding of the determinants of occlusion for achieving a stable and functional outcome? Option A. Relying on the patient's existing occlusal scheme and making minimal modifications to avoid disrupting their current functional patterns. Option B. Emphasizing the restoration of aesthetic tooth form and alignment, with occlusal adjustments made only if significant patient complaints arise post-treatment. Option C. Prioritizing the establishment of appropriate vertical dimension of occlusion and centric relation contacts, while ensuring minimal interferences in excursive movements. Option D. Focusing primarily on achieving ideal incisal guidance and canine guidance, assuming that other occlusal factors will naturally fall into place. The correct answer is C. Prioritizing the establishment of appropriate vertical dimension of occlusion and centric relation contacts, while ensuring minimal interferences in excursive movements. Explanation. Scenario analysis. This scenario presents a professional challenge because the dentist must integrate complex anatomical knowledge with patient-specific factors to achieve optimal occlusal harmony. Failure to accurately assess and address the determinants of occlusion can lead to functional problems, patient discomfort, and potential iatrogenic damage to the stomatic system. The challenge lies in synthesizing information from various sources, patient history, clinical examination, diagnostic aids, to make informed decisions about treatment planning and execution. Correct approach analysis. The correct approach emphasizes a comprehensive evaluation of all key determinants of occlusion. This includes assessing the condylar guidance, incisal guidance, horizontal and vertical overlap, and the influence of neuromuscular patterns. By considering these factors holistically, the dentist can develop a treatment plan that respects the patient's unique biomechanics and aims for a stable, functional, and comfortable occlusion. This aligns with professional best practices and regulatory expectations for providing evidence-based, patient-centered care, ensuring that treatment decisions are grounded in a thorough understanding of the underlying principles of occlusion and their clinical application. Incorrect approaches analysis, focusing solely on the vertical dimension of occlusion, without considering the dynamic movements and interferences, is a significant regulatory and ethical failure. This approach neglects the crucial role of condylar and incisal guidance in guiding mandibular movement and maintaining stability. It can lead to premature contacts, muscle strain, and temporomandibular joint (TMJ) dysfunction, violating the duty of care to avoid harm. Prioritizing aesthetics over functional determinants of occlusion is another regulatory and ethical lapse. While aesthetics are important, a functionally compromised occlusion, even if aesthetically pleasing, can lead to long-term problems. This approach fails to uphold the principle of beneficence by not ensuring the long-term health and function of the patient's stomatic system. Ignoring the influence of existing restorations and their occlusal schemes is also professionally unacceptable. Existing restorations, if not properly evaluated, can dictate or interfere with the desired occlusal outcome. Failing to account for these can result in occlusal disharmony, wear on natural teeth, and potential failure of the restorations, contravening the standard of care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient history and clinical examination. This should be followed by the evaluation of all relevant determinants of occlusion, including static and dynamic occlusal relationships, neuromuscular factors, and the influence of existing conditions and restorations. Diagnostic aids such as mounted study casts, occlusal analysis software, and appropriate imaging should be utilized. Treatment planning should then integrate this comprehensive data to formulate a strategy that prioritizes functional harmony, stability, and patient comfort, while also considering aesthetic goals. Regular reevaluation throughout treatment is essential to ensure the desired occlusal outcome is achieved and maintained. Question 13. Benchmark analysis indicates that a dental practitioner is explaining the structure of a tooth to a patient. When discussing the layer beneath the enamel, which of the following explanations most accurately and comprehensively describes the formation, structure, and properties of dentin in a manner suitable for patient understanding, while adhering to regional dental examination standards? Option A. Dentin is a hard, calcified tissue that primarily consists of inorganic salts, making it very strong. It is formed by ameloblasts and is located between the enamel and the pulp. Option B. Dentin is formed by odontoblasts and is a dense, mineralized tissue that is largely acellular. It is located beneath the enamel and is primarily responsible for the tooth's color. Option C. Dentin is formed by odontoblasts, which are specialized cells located at the periphery of the pulp. It is composed of an organic matrix, primarily collagen, and is mineralized with hydroxyapatite crystals. Dentin contains microscopic tubules that extend from the pulp to the dentinoenamel junction, housing fluid and nerve endings, which contribute to its sensitivity and ability to respond to stimuli. Option D. Dentin is a non-vital, inert tissue that is deposited throughout life by cells within the pulp chamber. It is primarily composed of calcium phosphate and offers no protection to the underlying pulp. The correct answer is C. Dentin is formed by odontoblasts, which are specialized cells located at the periphery of the pulp. It is composed of an organic matrix, primarily collagen, and is mineralized with hydroxyapatite crystals. Dentin contains microscopic tubules that extend from the pulp to the dentinoenamel junction, housing fluid and nerve endings, which contribute to its sensitivity and ability to respond to stimuli. Explanation. Scenario analysis. This scenario presents a professional challenge in a clinical setting where a dental practitioner must accurately identify and explain the histological composition of dentin to a patient. The challenge lies in translating complex biological information into understandable terms while maintaining professional integrity and adhering to patient communication standards. Misinformation or an incomplete understanding can lead to patient anxiety, distrust, and potentially impact treatment adherence. The practitioner must demonstrate a thorough grasp of dentin's formation, structure, and properties, ensuring the explanation is both scientifically accurate and clinically relevant. Correct approach analysis. The correct approach involves a clear, concise, and accurate explanation of dentin's formation, structure, and properties, emphasizing its role in supporting enamel and protecting the pulp. This aligns with best professional practice by prioritizing patient education and informed consent. Regulatory frameworks, such as those governing dental practice and patient rights, e.g., general principles of good practice and patient care expected by professional bodies like the General Dental Council in the UK or equivalent regional boards, mandate clear communication and the provision of understandable information to patients. Ethically, this approach upholds the principle of beneficence by empowering the patient with knowledge about their oral health. Incorrect approaches analysis. An approach that focuses solely on the mineral content of dentin without mentioning its organic matrix or cellular components would be an incomplete and therefore professionally unacceptable explanation. This fails to provide a holistic understanding of dentin's properties and its dynamic nature, potentially misleading the patient about its resilience and sensitivity. It could be seen as a failure to meet the standard of care in patient communication, as expected by regional dental boards. An approach that incorrectly attributes the formation of dentin to ameloblasts, the cells responsible for enamel formation, is a fundamental scientific error. This demonstrates a lack of foundational knowledge in dental histology, which is a serious professional failing. Such misinformation could lead to a misunderstanding of dental development and pathology, potentially impacting diagnostic and treatment decisions. This would contravene regulatory requirements for maintaining professional competence and providing accurate information. An approach that describes dentin as a static, inert tissue, devoid of any capacity for repair or response to stimuli, is also professionally unacceptable. Dentin is a vital tissue that can undergo physiological and pathological changes, including secondary and tertiary dentin formation. Failing to acknowledge this dynamic nature misrepresents the biological reality and could lead to inappropriate patient expectations or management strategies. This would fall short of the expected standard of professional knowledge and communication. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accurate knowledge recall, clear communication, and patient-centered education. This involves 1. Activating relevant knowledge base regarding dental histology and physiology. 2. Tailoring the explanation to the patient's level of understanding, avoiding overly technical jargon. 3. Ensuring the explanation is scientifically accurate and clinically relevant. 4. Verifying the patient's comprehension and addressing any questions or concerns. 5. Adhering to professional and ethical guidelines for patient communication and informed consent. Question 14. The performance metrics show a higher than average rate of periodontal disease recurrence in patients treated by your practice. Considering the etiology, pathogenesis, classification, clinical presentation, diagnosis, and management of periodontitis, which of the following approaches best addresses this trend and aligns with best professional practice? Option A. Implement a more rigorous recall schedule for all patients diagnosed with periodontitis, ensuring more frequent professional cleanings and oral hygiene reinforcement. Option B. Conduct a comprehensive review of all recent periodontitis diagnoses, focusing on the thoroughness of initial periodontal charting, radiographic interpretation, and the integration of systemic health factors and patient lifestyle into the treatment planning process. Option C. Increase the frequency of scaling and root planing procedures for all patients exhibiting any signs of gingival inflammation, regardless of probing depths or attachment loss. Option D. Standardize the treatment protocol for all forms of periodontitis, ensuring every patient receives the same set of interventions immediately following diagnosis. The correct answer is A. Implement a more rigorous recall schedule for all patients diagnosed with periodontitis, ensuring more frequent professional cleanings and oral hygiene reinforcement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to integrate diagnostic findings with a patient's systemic health and lifestyle factors to formulate an effective, individualized treatment plan for periodontitis. The complexity arises from the multifactorial nature of periodontal disease, where local factors, plaque, calculus, interact with systemic conditions, diabetes, immune status, and patient behaviors, smoking, oral hygiene. Mismanagement can lead to disease progression, tooth loss, and potential systemic health implications, impacting patient quality of life and trust. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive diagnostic assessment that includes a thorough periodontal charting, radiographic evaluation, and consideration of systemic health and patient-reported factors. This aligns with regulatory frameworks that mandate evidence-based practice and patient-centered care. Specifically, it reflects the ethical obligation to provide the highest standard of care, ensuring that treatment decisions are informed by a complete understanding of the patient's condition and risk factors. This approach minimizes the risk of misdiagnosis or incomplete treatment, thereby optimizing patient outcomes and adhering to professional guidelines for periodontal management. Incorrect approaches analysis. An approach that solely focuses on scaling and root planing without a comprehensive assessment of systemic factors or patient compliance risks is professionally unacceptable. This failure to consider the multifactorial etiology of periodontitis can lead to suboptimal treatment outcomes and disease recurrence, violating the principle of providing thorough and effective care. It may also contravene regulatory requirements for a complete patient evaluation prior to initiating treatment. An approach that delays definitive treatment based on a single diagnostic finding, such as mild gingival inflammation, without considering the full periodontal picture, probing depths, attachment loss, radiographic evidence, is also professionally flawed. This can result in the progression of periodontitis, leading to irreversible damage and increased treatment complexity later. It demonstrates a lack of due diligence in diagnosis and management, potentially falling short of the expected standard of care. An approach that prescribes a standardized treatment protocol for all patients diagnosed with periodontitis, irrespective of disease severity, systemic health, or individual risk factors, is professionally inadequate. This generic approach fails to acknowledge the unique needs of each patient and the nuanced pathogenesis of periodontal disease, potentially leading to ineffective treatment and patient dissatisfaction. It neglects the ethical imperative to tailor care to the individual. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a comprehensive patient history and clinical examination. This includes detailed periodontal charting, radiographic interpretation, and an assessment of systemic health and lifestyle factors. Based on this complete picture, a differential diagnosis should be established, followed by the development of an individualized, evidence-based treatment plan. Regular reevaluation and adjustment of the treatment plan are crucial to monitor progress and ensure optimal outcomes, always adhering to the highest ethical and regulatory standards of care. Question 15. The performance metrics show a consistent pattern of increased enamel wear and subtle changes in tooth shape observed across a cohort of patients presenting for routine checkups. These changes are more pronounced in older age groups. What is the most appropriate professional response to these findings? Option A. Conduct a thorough patient history review, including dietary habits, parafunctional activities, and medical condition, alongside a comprehensive clinical examination to determine the underlying etiology of the observed morphological changes and formulate a targeted management plan. Option B. Advise patients that these changes are a normal part of aging and require no specific intervention, focusing only on maintaining basic oral hygiene. Option C. Document the observed wear and shape changes as age-related phenomena and schedule follow-up appointments without further investigation into potential causes. Option D. Immediately recommend extensive restorative treatments to correct the perceived aesthetic deficiencies caused by the enamel wear and shape alterations. Correct answer is A. Conduct a thorough patient history review, including dietary habits, parafunctional activities, and medical conditions, alongside a comprehensive clinical examination to determine the underlying etiology of the observed morphological changes and formulate a targeted management plan. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the dental practitioner to interpret subtle, age-related changes in tooth morphology and correlate them with potential underlying health conditions or lifestyle factors. The challenge lies in moving beyond a purely descriptive observation to a diagnostic and prognostic assessment, which carries significant ethical and professional responsibility. Misinterpreting these changes could lead to delayed or incorrect treatment, impacting patient outcomes and trust. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates observed morphological changes with the patient's overall health history, lifestyle, and other clinical findings. This aligns with best professional practice by adopting a holistic view of the patient. Specifically, it emphasizes the importance of differential diagnosis, considering various etiological factors for the observed changes, and formulating a treatment plan that addresses the root cause rather than just the symptom. This approach is ethically sound as it prioritizes patient well-being and informed decision-making, and it is professionally responsible by adhering to the principles of evidence-based dentistry and continuous professional development. Incorrect approaches analysis. One incorrect approach involves solely focusing on the aesthetic implications of the morphological changes without investigating their cause. This fails to meet the professional standard of care by neglecting potential underlying pathology, which could have systemic health implications. Ethically, it prioritizes superficial concerns over patient health and safety. Another incorrect approach is to immediately attribute the changes to a single, common cause without considering other possibilities or gathering further information. This demonstrates a lack of critical thinking and can lead to misdiagnosis and inappropriate treatment. It violates the ethical principle of beneficence by potentially causing harm through incorrect intervention. A third incorrect approach is to dismiss the observed changes as insignificant due to the patient's age, assuming they are an inevitable part of aging. This is a failure of professional diligence and can overlook early signs of disease or significant wear patterns that require intervention. It is ethically problematic as it abandons the patient's care based on a generalization rather than individual assessment. Professional reasoning. Professionals should approach such situations by first meticulously documenting all observed morphological changes. This should be followed by a thorough patient history, including medical, dental, and lifestyle factors. A comprehensive clinical examination, including palpation, percussion, and potentially radiographic assessment, is crucial. The practitioner should then engage in differential diagnosis, considering all plausible causes for the observed changes. Finally, a collaborative discussion with the patient, outlining findings, potential causes, and treatment options, leading to an informed consent process, is paramount. This systematic, evidence-based, and patient-centered approach ensures the highest standard of care. Question 16. Investigation of a patient's dental records reveals radiographic evidence of a tooth exhibiting a single, relatively broad root with a crown that has a distinct lingual fossa and a prominent cingulum, along with a single cusp. Considering the comparative anatomy of incisors, canines, premolars, and molars, which tooth type's typical morphology is most closely represented by these characteristics? Option A maxillary first premolar. Option B, a maxillary central incisor. Option C, a mandibular canine. Option D, a mandibular first molar. The correct answer is B, a maxillary central incisor. Explanation. This scenario is professionally challenging because it requires the application of detailed anatomical knowledge of various tooth types to a clinical diagnostic situation. The challenge lies in accurately identifying subtle differences in crown and root morphology that are critical for diagnosis and treatment planning, especially when presented with potentially ambiguous or incomplete information. Careful judgment is required to differentiate between normal variations and pathological presentations, ensuring patient safety and effective care. The correct approach represents best professional practice because it systematically compares the observed characteristics of each tooth type against established anatomical norms. This methodical process, grounded in the detailed study of incisors, canines, premolars, and molars, including their surfaces, ridges, grooves, and cusps, allows for precise identification and differentiation. This aligns with the fundamental principles of dental diagnostics and treatment planning, which are implicitly or explicitly governed by regional board examination standards that emphasize accurate knowledge and application. Ethical practice demands that practitioners base their decisions on sound scientific understanding, minimizing the risk of misdiagnosis and inappropriate treatment. An incorrect approach that relies solely on superficial similarities or generalized knowledge fails to meet the required diagnostic rigor. This could lead to misidentification of tooth type, potentially resulting in incorrect treatment decisions, such as inappropriate restorative procedures or misinterpretation of radiographic findings. Such an approach would represent a failure to adhere to the expected standard of care and the detailed anatomical knowledge mandated by professional licensing and examination bodies. Another incorrect approach that prioritizes speed over accuracy by making assumptions without thorough examination of all anatomical features is also professionally unacceptable. This bypasses the critical step of detailed comparative analysis, increasing the likelihood of error. This demonstrates a lack of diligence and a disregard for the meticulous nature of dental diagnostics, which can have significant consequences for patient outcomes and professional reputation. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly assess all available clinical and radiographic information for the tooth in question. 2. Systematically compare the observed crown and root anatomy, including surfaces, ridges, grooves, and cusps, with the known characteristics of each tooth type, incisors, canines, premolars, molars. 3. Consider differential diagnoses, weighing the likelihood of various tooth types and potential pathologies based on the anatomical findings. 4. Consult anatomical references or colleagues if there is any uncertainty. 5. Formulate a diagnosis and treatment plan based on the most accurate and comprehensive assessment of the tooth's morphology. Question 17. What factors determine the most appropriate diagnostic and treatment planning approach for assessing the pulp chamber and root canals of a tooth, considering both anatomical variations and potential pathological changes? Option A. Comprehensive evaluation of radiographic findings, clinical signs and symptoms, and patient history. Option B. Treatment planning based solely on the perceived complexity of the root canal system, as initially visualized on a periapical radiograph. Option C. Prioritization of the simplest and quickest diagnostic methods, regardless of diagnostic accuracy. Option D. Exclusive reliance on the most recent anatomical textbook descriptions of pulp chamber and root canal morphology. Correct answer is A. Comprehensive evaluation of radiographic findings, clinical signs and symptoms, and patient history. Explanation. This scenario presents a professional challenge because the detailed study of the pulp chamber and root canals requires a clinician to integrate anatomical knowledge with diagnostic findings to formulate an appropriate treatment plan. Misinterpreting these anatomical features or failing to correlate them with clinical signs and symptoms can lead to suboptimal treatment, patient discomfort, or even treatment failure. The regulatory framework for dental professionals, as exemplified by the General Dental Council, GDC in the UK, emphasizes the need for practitioners to maintain up-to-date knowledge and skills, and to provide treatment that is in the best interests of the patient. The correct approach represents best professional practice because it involves a comprehensive assessment that considers the dynamic nature of dental anatomy and pathology. This aligns with GDC Principle 2, maintain proper standards of professional practice and conduct, and Principle 4, work with patients in a way that is appropriate to their needs. By thoroughly evaluating radiographic evidence, clinical signs, and symptoms, the practitioner can accurately diagnose the condition of the pulp and root canal system, thereby enabling the selection of the most effective and least invasive treatment. This meticulous approach minimizes risks and maximizes the likelihood of a successful outcome, fulfilling the duty of care owed to the patient. An incorrect approach that relies solely on a single diagnostic tool, such as only radiographic interpretation without considering clinical signs, is professionally unacceptable. This failure to gather and synthesize all relevant information breaches the duty of care and could lead to misdiagnosis. Ethically, it violates the principle of acting in the patient's best interest. Another incorrect approach, such as proceeding with treatment based on assumptions about the canal anatomy without adequate investigation, demonstrates a lack of due diligence and professional competence, contravening GDC standards for patient safety and effective treatment. Professionals should employ a decision-making framework that begins with a thorough patient history and clinical examination. This is followed by the judicious use of diagnostic aids, including radiographs, to visualize the internal anatomy of the tooth. The interpretation of these findings must then be correlated with the clinical presentation to form a differential diagnosis. Treatment planning should be a collaborative process, considering the patient's overall health, preferences, and the prognosis of the tooth. Regular review and adaptation of the treatment plan based on ongoing assessment are also crucial components of professional decision-making. Question 18. When evaluating a superior view of a disarticulated cranial bone, a prominent feature is the presence of a large, irregular opening at the posterior aspect, through which the spinal cord passes. This bone also exhibits a rounded eminence on its external surface, posterior to the external auditory meatus. Which cranial bone is being described, and what is the significance of these features in relation to its anatomical context? Option A. The temporal bone, distinguished by the mastoid process and the mandibular fossa, which forms part of the cranial base and houses the middle ear. Option B. The occipital bone, characterized by the foramen magnum and the external occipital protuberance, which articulates with the atlas and provides muscle attachments. Option C. The parietal bone, recognized by its broad, curved shape and the presence of the sagittal and coronal sutures, which forms the superior and lateral aspects of the skull. Option D. The sphenoid bone, identified by its greater and lesser wings, and the sella turcica, which forms a significant portion of the cranial base and orbits. The correct answer is B. The occipital bone, characterized by the foramen magnum and the external occipital protuberance, which articulates with the atlas and provides muscle attachments. Explanation. This scenario presents a professional challenge in anatomical identification and differentiation, requiring precise knowledge of cranial bone morphology and their associated features. The difficulty lies in distinguishing between subtle anatomical variations and significant pathological indicators, especially when relying solely on descriptive features without direct palpation or advanced imaging. Careful judgment is required to accurately identify the bone and its specific landmarks, which is crucial for subsequent diagnostic or treatment planning. The correct approach represents best professional practice because it demonstrates a systematic and accurate application of anatomical knowledge. It correctly identifies the bone based on a combination of its defining characteristics, such as the presence of a specific foramen and its location relative to other cranial structures. This aligns with the fundamental principles of anatomical science and diagnostic accuracy, which are implicitly expected in any regional board examination focused on health sciences. Adherence to accurate anatomical terminology and identification is a core ethical and professional responsibility. An incorrect approach that misidentifies the bone due to overlooking a key feature, such as the absence of the cribriform plate or the presence of the mastoid process, represents a failure in fundamental knowledge application. This could lead to misdiagnosis or inappropriate treatment, violating the ethical duty of competence. Another incorrect approach that focuses on a feature common to multiple bones without considering the unique combination of features for the specific bone demonstrates a lack of analytical depth and attention to detail, which is a regulatory failure in demonstrating mastery of the subject matter. An approach that relies on a superficial or generalized description without referencing specific anatomical landmarks or foramina fails to meet the expected standard of precision and detail required for professional practice and examination. The professional decision-making process for similar situations should involve a methodical review of all presented anatomical features. This includes systematically considering the defining characteristics of each cranial bone, such as the presence and location of foramina, e.g., foramen magnum, foramen rotundum, foramen ovale, cribriform plate, the nature of sutures, e.g., sagittal, coronal, lambdoid, and prominent landmarks, e.g., external occipital protuberance, mastoid process, supraorbital ridge. Comparing these observed features against established anatomical knowledge and prioritizing unique identifiers is essential for accurate identification. If uncertainty remains, seeking clarification or consulting reliable anatomical resources would be the next professional step. Question 19. Cost-benefit analysis shows that while some interventions for delayed tooth eruption can be effective, a thorough understanding of the underlying causes is paramount. Considering the multifactorial nature of tooth eruption, which approach best guides clinical decision-making for a child presenting with a congenitally missing permanent tooth adjacent to a primary tooth that has not exfoliated. Option A. Advise the parents that delayed eruption is common and often resolves spontaneously, recommending a wait-and-see approach without further diagnostic investigation. Option B. Prioritize a comprehensive assessment of genetic, local, and systemic factors that could influence eruption, including detailed radiographic evaluation and consideration of the patient's overall development before formulating a treatment plan. Option C. Immediately recommend orthodontic intervention to create space, assuming the primary tooth will eventually exfoliate and the permanent tooth is simply impacted due to lack of room. Option D. Focus solely on the absence of the primary tooth's root resorption as the primary indicator for intervention, suggesting extraction of the primary tooth to stimulate eruption. The correct answer is B. Prioritize a comprehensive assessment of genetic, local, and systemic factors that could influence eruption, including detailed radiographic evaluation and consideration of the patient's overall development, before formulating a treatment plan. Explanation: this scenario is professionally challenging because it requires the dental professional to synthesize complex biological factors influencing tooth eruption and apply this knowledge to a clinical decision-making process that balances patient well-being with the practicalities of treatment. The challenge lies in accurately identifying the primary drivers of delayed eruption and differentiating between conditions that are self-limiting and those requiring intervention. Careful judgment is required to avoid unnecessary or premature treatment, which could have negative consequences for the developing dentition. The correct approach represents best professional practice because it prioritizes a thorough understanding of the multifactorial nature of tooth eruption. By considering genetic predispositions, local factors such as crowding or obstructions, and systemic influences like hormonal imbalances or nutritional deficiencies, the professional can arrive at an accurate diagnosis. This comprehensive assessment aligns with the ethical obligation to provide evidence-based care and to act in the best interest of the patient. Regulatory frameworks for dental professionals emphasize the importance of accurate diagnosis and appropriate treatment planning, which are directly supported by this approach. An incorrect approach that focuses solely on a single, common cause of delayed eruption, such as mild crowding, without investigating other potential etiologies, represents a regulatory and ethical failure. This could lead to misdiagnosis and inappropriate treatment, potentially causing harm to the patient. For instance, if a systemic condition is the underlying cause, treating only the local symptom would be ineffective and delay necessary systemic management, violating the duty of care. Another incorrect approach might be to recommend immediate, aggressive intervention without a period of observation, which could be considered premature and potentially iatrogenic, failing to adhere to the principle of do no harm. Furthermore, neglecting to consider the patient's age and developmental stage when assessing eruption patterns is a failure to apply established clinical guidelines and could lead to inappropriate management decisions. The professional decision-making process for similar situations should involve a systematic evaluation. This begins with a detailed patient history, including family history of dental anomalies and any relevant medical conditions. A thorough clinical examination, including radiographic assessment, is crucial for identifying local factors. Based on this information, the professional should then formulate a differential diagnosis, considering all plausible causes of delayed eruption. A period of watchful waiting, with regular reassessments, may be appropriate for certain conditions. If intervention is deemed necessary, the treatment plan should be tailored to the specific etiology and the patient's individual needs, always prioritizing the least invasive and most effective option. This process ensures that decisions are informed, ethical, and compliant with professional standards. Question 20. Risk assessment procedures indicate a patient presenting with acute, severe pharyngeal pain and difficulty swallowing, suggestive of a deep neck space infection. The attending physician is momentarily unavailable. Which of the following actions best aligns with the regulatory framework for regional board examinations concerning the immediate management of such a critical head and neck condition? Option A. A registered nurse, experienced in critical care but without specific advanced training in head and neck surgical procedures, administers a potent analgesic and prepares the patient for transfer to a different facility without consulting the medical team about the potential need for immediate airway intervention. Option B. A physician assistant, who has completed a general medical training program but lacks specialized experience in otolaryngology, decides to perform an emergent tracheostomy based on their interpretation of the patient's breathing pattern, without direct physician supervision or confirmation of the need. Option C. A junior medical intern, with basic knowledge of head and neck anatomy but no specific training in advanced airway assessment or infection management, attempts to administer a broad-spectrum antibiotic intravenously without consulting a senior clinician. Option D. A senior resident physician, with demonstrated proficiency in airway management and head and neck anatomy, initiates a bedside ultrasound to assess for potential airway compromise and guides immediate intravenous fluid resuscitation, while simultaneously attempting to contact the attending physician. Correct answer is D. A senior resident physician, with demonstrated proficiency in airway management and head and neck anatomy, initiates a bedside ultrasound to assess for potential airway compromise and guides immediate intravenous fluid resuscitation, while simultaneously attempting to contact the attending physician. Explanation: this scenario is professionally challenging because it requires the practitioner to balance immediate patient needs with the strict adherence to regulatory frameworks governing the scope of practice and the appropriate delegation of medical tasks. The practitioner must exercise sound clinical judgment to determine the most effective and compliant course of action when faced with a situation that could be managed by different levels of healthcare professionals. The correct approach represents best professional practice because it prioritizes patient safety and ensures that procedures are performed by individuals with the appropriate qualifications and under the correct supervision, as mandated by the relevant regional board examinations regulatory framework. This approach upholds the principle of acting within one's scope of practice and respecting the established hierarchy of medical responsibility, thereby preventing potential harm to the patient and maintaining professional integrity. An incorrect approach that involves a junior practitioner performing a procedure beyond their current training and certification, without direct supervision from a qualified senior clinician, represents a significant regulatory and ethical failure. This violates the principle of competence and can lead to patient harm due to lack of experience or skill. It also undermines the regulatory framework that establishes clear lines of responsibility and requires appropriate training and credentialing for specific medical interventions. Another incorrect approach, such as delaying necessary intervention due to an overly rigid interpretation of protocol that does not account for emergent patient needs, could also be professionally unacceptable. While adherence to regulations is crucial, professional judgment must also be applied to ensure timely and appropriate care. This could lead to adverse patient outcomes and potentially violate the duty of care. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, the available resources, the practitioner's own scope of practice and competencies, and the relevant regulatory guidelines. This includes consulting with senior colleagues or supervisors when uncertainty exists, ensuring all actions are documented, and always prioritizing patient well-being within the bounds of legal and ethical practice.